Hi, I'm Dr. Sridhar Kalyanasundaram. Welcome to my channel. In this video, I would like to discuss 5 do's and don'ts for the second half of the first year, or probably until 6 months to 18 months of age. So first we will discuss the don'ts. So the first point is, many parents are tempted to buy a walker for their child, or they are gifted a walker by friends and relatives. So my advice is, don't accept the walker either as a gift or don't buy it as well. This is because the baby walkers, where they sit and they have wheels and they push on their feet and run, these are not ideal. They are just a toy. They don't really help in walking. Some parents have the misconception that the walkers are needed for the baby to learn walking. It's absolutely not. There are risks of accidents. The walker may hit some furniture and may topple over. The baby may fall on the head, and the impetus it is given, the momentum, may cause the baby to be thrown. And I've seen a few accidents from walkers. The second point is the toe walking. Some babies have a tendency to push on their toes, and this habit persists, so it actually delays their actual walking. So a walker is not recommended. The walker where the baby pushes can be considered in babies who don't walk by 1 year of age, when they're able to stand on their own. This will encourage them to gradually start moving, but this is a different one from the round walker where they sit and push. The second point is obviously screen time. So many parents introduce phones or iPads, nursery rhymes. They're obviously catchy. The babies find them attractive, but we don't recommend screen time at all. I would refer you to my video on screen time with Dr. Lodha, where we explain clearly that the developing brain needs two-way communication and the three-dimensional aspect as well. So screen time leads to a baby becoming impatient. They start expecting things to happen as in edited videos as fast as that, and life doesn't work like that. So please avoid screen time. If you have older siblings, encourage them to use the screen only when the infant is asleep if possible, or keep the infant in a different room. Never get used to keeping the child quiet with the phone, because this will aggravate them to demand it. So tantrums also start at this age. So please approach it with care, and better not introduce at all. And if at all you use it, you can use it for video calls with your family. If the child is used already and you want to wean them off, one way is to use a slideshow of your family photos, for example, or something natural with the mild music. Of course, nursery rhymes as a song or as a music is fine, but don't show videos. It's very important because it affects their development, it affects their language development, interaction, social skills, and we do see some kids with delayed development with autism-like features just because they have been overdosed with screen time. So the third point is not to give items which can choke. So till they are about 2 years old, the round objects which they can choke, nuts, for example, peanuts, or even gems or smarties like sweets, should not be given to these infants. And if you have older kids whom you are giving this, make sure that you just give it when they are away from the infant, and make them understand that it shouldn't be taken near the baby. Very often choking happens because of these issues. Also make sure that the toys that the older kids have, parts like magnets may be there, and you may have small parts like wheels which come off. The good companies which make toys always specify that it's over 3 years of age, and that's the reason that they may have small parts. And if your child's toys has small parts, you should keep it away. The same applies for small building toys like Lego. So make sure you're keeping them away. The fourth point is obviously sweets which are given. So babies are not exposed to sweet taste except from natural fruits in the first year of life. Sweet doesn't mean just sugar. Any form of sweetening like jaggery, honey should not be used. There is another main reason for not using honey in the first year, and that's the risk of infant botulism, which can cause paralysis in the baby because their immune system cannot resist these spores. So be careful not to introduce any sweet items before 1 year. Even after 1 year, the less sweets you expose the child to, the better, because the taste preference for sweets is very strong naturally, and sweets are known to cause hyperactivity as well. So most of the sweets are just carbohydrates, so nutritive value is not great either. And the last point in terms of don'ts is don't stick with just pureed food once you start progressing, and don't forget to reduce the milk intake, because as I mentioned in the video on complementary feeding, if you delay introduction of different textures beyond 8 or 9 months, some children do not take these textures and they demand the pureed food. Some parents give milk instead of the solids when the child refuses. This leads to their taking far more milk than they need. One obvious disadvantage is excess weight gain. The other problem can be that they don't progress enough on solids. So don't give any substitute. Be relaxed about your child's feeding pattern. So this is about the don'ts. And coming on to the do's, we have one point where we have to introduce variety of food. So when you start weaning anytime between 4 and 6 months, as we discussed in the video on complementary feeding, you start introducing variety. Don't just stick with ready-made foods, cereals which come in boxes. Of course, they have their benefits. They are supplemented with ions and vitamins, but you need variety, you need home food. So don't stick with the same kind of food, and give water along with the meals as well. Vitamin and iron supplements is other important do's in the second half. Multivitamins can be considered in the breastfeeding babies, and again iron supplements are needed both for breastfeeding and formula feeding babies, because the breast milk is not enough in the iron content, and as the baby grows, they run out of their iron stores they have accumulated. So the second half of the first year, iron supplements and iron-rich foods are important, because iron plays a very important role in brain development and concentration as well. So the third point I would like to say is a good habit of reading. So babies often like to move around, so you have to hold them down at least for some time, engage them. And reading is a good habit. You don't need to tell stories. You just have a picture book and keep repeating the same thing. This improves their listening skills. This makes them less likely to get hyperactive. And also this habit may encourage them to have a good bedtime routine. And we should start disciplining. So this is the fourth point. So remember that from 7 to 8 months onwards, they're observing, they start stretching their freedom limits, and they like to explore how far they can get away with. So remember that children can understand, and they start thinking, they know how to manipulate you. So they're not as innocent as they seem. So discipline should be thought of, and if tantrums happen, start getting a consistent pattern. I would like you to watch the video on discipline approach, and this starts right from 6 to 7 months of age. So please don't forget to inculcate a habit of discipline. This comes to anything that happens at home, anything taken away from the child's hand that they tantruming for screen time, tantruming for sweets, anything like that. I mean, try to be consistent, irrespective of your mood, and the consistency should be between the carers. So the father, mother, grandparent, they should all react the same way to a similar situation. So this is very important when it comes to discipline. And the last point is, don't forget the dental care for your baby, because from 4 to 6 months onwards, start cleaning the mouth with the washcloth, and when the teeth start erupting, you need to start brushing firstly with the finger brush, and then using a proper brush, baby brush, with the toothpaste meant for the age of 0 to 4 years. These are low fluoride pastes. The water content of fluoride is very low here. So it's very important that they get the paste, and it also helps to prevent caries. Look at other aspects like not giving strained fruits which are sucked through the mouth. Avoid the pacifier beyond 4 months of age, because beyond this it's habit forming, and obviously it's a child and the parent, those both are getting used to it. So you can aim to have a checklist where you start dental care and you stop pacifier around 4 months of age. Also, please watch the video by Dr. Sania on dental care in babies. I hope this helps, and I would like you to share this with all your friends and relatives and encourage them to subscribe as well. So thank you so much, and if any comments, please mention it in the comments, and if you like it, please click on the like button. Thank you.